Warm good evening to everyone. Myself, Dr. John Samuel. I run an eye hospital in Kaliakkavilai, Kanyakumari district, and I'm very happy and proud to be a part of this wonderful CME, which is multidisciplinary approach towards COVID-19. And my topic of interest today is COVID-19 and its implications in the eye. So I'll be talking in brief about few studies which are done worldwide and about possible routes of transmission and the importance of eyewear. So if you look at this picture, it shows three types of viruses, which is the coronavirus family, which we have faced till date. It actually originated in 2002 when the SARS outbreak came in China. That time the virus was kind of a less virulent variety, and it started in 2002 and lasted for around 2004. And after that, the next successor, the Middle East Respiratory Syndrome, or MERS as we know it, came. So it was another mutant variety of the same coronavirus, which presented in the year 2012. And the outbreak was again not much virulent as what we are seeing now. And there are a few cases reported even towards the middle of 2019 in most of the Middle East countries, including Saudi Arabia, Abu Dhabi, etc. And then comes to the topic of importance today, which is COVID-19, which came as a big shock to us in December of 2019, which originated from Wuhan, China. And the alarming spread and the pandemic situation, as we all know, is the present scenario. So I'll be talking in detail about the person of interest today, which is the COVID-19. So if you see here, if you see this picture of this eye and its relevance to the nasal cavity, we'll understand the importance of eye being an important source of infection. So if you see here, any droplet or any viruses which come in contact with the eye tears or the conjunctival sac or any of the exposed part of the eye, it can easily migrate through the lacrimal sac apparatus. You can see in this picture that all the tears which are produced from the lacrimal gland get drained through the lacrimal sac, and it goes through the upper and lower canaliculus, and eventually it drains in the nasal cavity through the inferior meatus of the nose. So it's very clear that it has a very close contact with the nose, and so the virus transmission to the respiratory tract is very evident. So these are few keywords which I'll be talking in the coming slides. And coming to the virus of attention, if you see this picture, this is actual electron microscopic view of the virus itself. It is an encapsulated single-stranded RNA virus which has spike glycoprotein, which interacts with the receptor binding domain known as angiotensin converting enzyme 2. We heard in the previous talks also regarding the same angiotensin converting enzyme 2 receptors, which is present in multiple parts of the body, including the respiratory tract, renal tract, and intestinal tracts. In the eye, it is predominantly this particular receptor is expressed in the conjunctival epithelium, the choroid, the retina, the vascularized retinal pigment epithelium. So ultimately, the discovery of this virus in tear samples or conjunctiva, which was found eventually, and was not surprising at all. So we need to actually see that lacrimal drainage pathway plays an important role in the transmission also. And as far as most of the studies done worldwide, most and common predominant eye symptom is conjunctivitis, which is also called as pink eye, and we call it the common Madras eye. So I'll be talking about few literature insights presented and published from all over the world. So this is actually nothing but a paper which highlights the 2003 SARS outbreak. As I told before, even SARS was contracted by a similar virus of the coronavirus family. And at that time, they did a study and they took tear samples and they tested it for that particular virus. And in that study, they have mentioned that most of the common ocular symptoms include conjunctival hyperemia, chemosis, epiphora, or increased ocular secretions. So that time they hypothesized the same which I discussed before, There could be direct inoculation of respiratory droplets or aerosols, which in turn can migrate through the nasopharynx, or it can retrograde way, it can come from the nasopharynx, or it could be due to hematogenous spread through the lacrimal gland. So this is another study which is done in the current outbreak, which was done in Hubei province in China. In this study, we can see that almost 1/3 of the patients included in the study with clinically confirmed COVID-19 presented with ocular manifestations. So the most common ocular manifestation include, as I said before, it was conjunctivitis with conjunctival hyperemia, chemosis, a lot of increased conjunctival secretions. So most of the blood investigations done in these patients showed a high incidence of WBC count and neutrophil count, and the blood level showed high levels of procalcitonin, C-reactive protein, and lactate dehydrogenase. This is another study which shows that only it is another varied presentation, because I told that conjunctivitis is a common presentation. This particular patient is a case report from Canada. This patient actually presented with keratoconjunctivitis, which is involvement of the cornea also along with the conjunctiva. And this particular patient's conjunctival swab was checked for RT-PCR, and they actually found it positive for SARS-CoV virus. Again, conjunctivitis can be the only presenting sign and symptom of COVID-19. This was a study done in Italy, and 5 atypical clinical presentation of COVID-19 that involved only the eyes, which was very shocking, because we all know that the asymptomatic carriers are the biggest threat in the spread of this particular disease. So this particular group of patients, 4 middle-aged male and 1 female, actually they didn't show any other sign of COVID-19. They didn't have any fever or any nasal symptoms or anything. They only presented with acute conjunctivitis. And since various studies were coming up, they actually did a nasopharyngeal swab, and RT-PCR came out to be strongly positive for COVID-19. Immediately, the patients were followed up with phone and made quarantine at home. They didn't develop any other symptoms throughout their quarantine. So this shows that conjunctivitis was only presenting sign and symptom. This is another study which signifies, like I told before, AAC receptors are present even in the retinal pigment epithelium. The retinal findings are very prominent, is what we can know by this study. So this particular study is published in the prestigious Lancet article, and OCT is a non-invasive imaging technique which most of you won't be aware of it. It is useful in demonstrating subclinical retinal changes in systemic conditions like diabetes mellitus, hypertension, and various neurological disorders like Parkinson's disease, Alzheimer's disease, as well as many viral infections. So this particular study was done in a hospital, and most of the patients were actually physicians and healthcare workers. So it involved 12 adults, 6 men and 6 women, aged 25 to 69 years of age. They are examined 11 to 33 days after COVID-19 symptom onset. The image showed that there were subtle cottonwool spots and microhemorrhages which were present along the retinal arcade. And these are few symptoms which we observe in many other retinopathies, including diabetic retinopathy. And also the subsequent OCT image actually showed hyperreflective lesions at the level of ganglion cell layer and the inner plexiform layer. So in both eyes, they had the similar finding. So this could strongly suggest that because these are the continuation of the central nervous system, it could be associated with the CNS manifestation, which we discussed in the previous talk. So this could be a strong indicator of the same, and more research has to be done on the same. Indeed, it's a convalescence phase, but still, even after that, the patient is infective. And lab-wise, as per the current data, the nasal swab and the blood investigations, the SARS-CoV-2 RNA and antigens are positive from day 1 to day 28. And if you see section-wise, for the first 1 week is a window period. That's only RT-PCR is positive here. From day 7 to say day 21, IgM turns out to be positive. In day 14, IgG turns out to be positive. Day 21, IgM again disappears. Day 28, both SARS-CoV-2 RNA and antigens start to disappear. This is a very interesting study which was done in Italy. Again, it's a case report. It involves a 65-year-old woman who traveled from Wuhan, China to Italy, and she was admitted in Italy. She presented on the first day. She presented with non-productive cough, sore throat, coryza, and she also had bilateral conjunctivitis. And she didn't have any fever till day 4. Day 4, she developed mild fever with nausea and vomiting. So again, the patient was examined, and investigation showed that RT-PCR was positive in the throat swab. And again, based on the previous studies, and since she presented with conjunctivitis, again they sent the ocular swab also for the RT-PCR, and they actually surprisingly they found viral RNA positive, and the patient actually was improving well. And on day 15, actually the conjunctivitis also started improving, and apparently by day 20 it was completely fine. But the main thing of significance here is if you see this particular slide, the SARS-CoV RNA was detected in the ocular swab days after it was undetectable in the nasal swab. There is a high chance of false negative PCR. So the WHO has recommended the use of only synthetic fiber swabs with plastic shafts for collection of conjunctival swabs rather than calcium alginate swabs, which is used. And because it may inactivate some viruses, and topical anesthesia also should never be used because it is also known to have some virucidal activity. And the volume of tears which is collected for testing also matters to a great extent. So we have listened to all the various studies which shows a very strong incidence of virus in tears. At the same time, we all know that there is an increased frequency of usage of alcohol-based hand rubs, and most of us know that hand rub and alcohol-based hand rubs especially pose a significant threat to the skin. A lot of medical practitioners develop allergic and irritant dermatitis, and in eye it's especially harmful because it's very highly toxic to the alcohol is generally very toxic to the eye, can cause severe toxic conjunctivitis, and it can almost erode the complete epithelium or the outermost layer of the cornea. And so it is also found that in this particular study almost 40% of the people affected were healthcare workers, and especially in this COVID times. So this particular condition is again very crucial because while using sanitizers, we should always follow the following precautions as mentioned in this slide. Always close your eyes while pressing the nozzle of the hand sanitizer. Keep it below your eye level. Don't keep it above you, so that you can at least reduce the aerosol spread. And always keep your doors open. And especially in this COVID times, it is recommended that we should not use much of AC and make maximum ventilation. Consult an ophthalmologist, and mild lubricants can also help. And main thing is try to limit the usage of sanitizers. You need not be overcautious. Maximum, if possible, try to use soap and running water for hands cleaning, which proves to be very effective in COVID-19 control. And usage of protective goggles or face shield by health practitioners is very important because any unavoidable splash can be prevented. And main thing is we should not panic in this situation. We should take all measures because this COVID-19 is not going to vanish in one day. It is going to stay with us for a while. We need to learn to live with it. It doesn't mean that we need to soak ourselves in hand sanitizers and all antivirals. It doesn't help us. We need to stop panicking and take proper preventive measures, and that can help us in the long way. In January 22, one of the chief respiratory specialists from Wuhan, he got infected. And when they found that he was in the main treatment panel, and he was always donning the complete PPE suit, including the N95 respirator, only thing he was not using was the eye goggles, and he didn't have any eye protection. He didn't use a face shield. and he turned out to be COVID-19 positive, and his one of the earliest presentation he developed was unilateral conjunctivitis. After that only he developed all the fever and all the respiratory symptoms. So after that, they thought that the only source which he could have developed is through exposure in the eye. So after that, they made it mandatory for all the medical personnel and people, all frontline workers, to use eye protection or face shield as a mandatory thing, along with N95 mask. So if you see in this picture, these are the various type of eye protection glasses available. We have strap-based, completely sealed eye protection goggles, which is always available in the market before also, which can be very useful in preventing any spillages, or even in the HIV episode. Most of the HIV kits, they recommend the use of eye goggles. So similar goggles should be worn while doing any surgery or any aerosol generating procedure, or you can even use goggles which can be worn over the prescription glasses. People who are myopes or who are using progressive glasses, actually they can wear this type of glasses, which are available readily now, which can be safely worn over the prescription glasses. And you also have completely covered prescription glasses again, which can be used only for the OP or an OT purpose, and it can be neatly sterilized and used again. And mostly for ophthalmologists, they find it very difficult with the face shield. So these kind of completely covered protection glasses with prescription powers can be used by them, which is easy while viewing microscopes and other imaging systems.
To protect the eyes, the glasses or visor must shield the eyes from both the front as well as the sides. A number of options are available on the market. Dedicated anti-fog glasses. All glasses should have protective side shields. Prescription glasses may be custom fitted with protective side shields. Should fogging of the glasses occur, taping the mask to the bridge of the nose will eliminate or reduce this problem. Protective goggles and shields required for protection against highly contagious diseases like Ebola, for instance. Masks with protective visors. Place the mask visor or protective glasses in position before scrubbing or gowning for surgery. Protect your eyes and ensure that all members of your surgical team do the same.
Where there is a risk of blood and body fluid splashes, a visor should be worn to protect the face. Place the visor in your hand with the strap or band in the other hand and pull across the top of the head. Place the visor across the forehead with the face of the visor firmly pointing downwards. Gloves should then be put on after the visor is comfortably in place. A mask may be worn underneath the visor if additional respiratory precautions are needed. To remove the visor, first remove gloves, then tilt the head forward slightly, pull the band of the visor across the top of the head and take off the visor away from the body. Do not touch the front surface of the visor as this will be contaminated. Discard into the bin or decontaminate for reusable visors.
Routine practice also. Many general physicians come across such conjunctivitis patients in the general practice also. So particularly in this scenario, thorough history of COVID-19 is essential for every patient. Whoever walks into your clinic, before stepping in, they should be questioned for any COVID-19 related symptoms, and they should be screened for fever, and oxygen saturation should be monitored, and chest x-ray if needed also should be done if the patient is planned for any surgery, and which is only for surgery, not recommended for all patients. And if the patient presents with conjunctivitis, unless they had any recent history of any trauma, kindly just have an initial checkup without touching the eye with a torchlight examination, with you donning all the necessary personal protective equipment. And if at all they have any related symptoms or any related history, it's always safe to quarantine them. And if everything is negative, if there are no signs of or any history which is related to that, maybe you can refer them to an ophthalmologist. And again, OCT scan and its role in this diagnosis has to be studied more. Few studies have recommended the usage of benzyl alkonium chloride, which is actually a preservative, which is used in, which is found in most of the eye drops. It's used as a common preservative material. So they recommend instilling this particular preservative included eye drops and simple lubricant eye drops, which can be installed by people who are exposed to such patients, especially ophthalmologists, optometrists, and eye care practitioners. And again, we all know that betadine or povidone is a well-known and readily available agent, which is highly antiviral. It has a very good antiviral property, and it is found to be very good and very effective against COVID-19 virus. It can actually kill the virus. So instilling that before any surgical procedure or any examination procedure is being followed and recommended in eye care practice. And chloroquine, again, family of hydroxychloroquine, a diluted formulation is also being experimented. And even hypertonic saline. Saline is told to have a well-known antiviral property. So even in few cases, even hypertonic saline is being used, especially before surgeries. And even benzyl alkonium chloride containing saline nasal drops are also under research now. It can serve as a preventive measure for mainly for frontline workers and health practitioners. So take home message: if you change, nothing will change. It means that in a sarcastic way, if you have all the right measures and right preventive measures and right safety measures, you nothing will change in your practice or the current situation. We can strongly face this COVID situation because, like I told, it won't disappear. Even finding a vaccine is still a question because they say the virus keeps mutating and everything. But still, if we follow the necessary preventive measures and safety measures, and we educate the common public also to do the same, we can actually make sure that this situation goes off. So ocular manifestation of COVID-19 and transmission of SARS-CoV represent an important source of infection both in the general population and healthcare providers. So and RT-PCR screening of the conjunctival swab needs to be explored more. It can prove as a very effective test and a very simple test compared to the nasopharyngeal swab. And all healthcare providers, especially the surgeons and the doctors, should definitely use goggles or at least a face shield, regardless of the patient's symptoms, which is very important. Just donning a mask and PPE is not enough. We should definitely use eye goggles and face shield. Thank you so much for listening to me. We can fight against COVID-19 together. Thank you.